Good morning and welcome to Albany Medical College and welcome to the Division of Cardiology. We here as faculty take your success both as future cardiologists and clinician researchers very, very seriously. Our feeling here as the faculty is that your success in research and scholarly activity is in large part due to your curiosity, drive, and persistence. Starting at the beginning of your first year, we will help you think about concepts and meet each of the faculty to discover with whom you would like to work over the course of your 3 years. Your scholarly project will grow as a first year and take on life of its own, and then you will complete it over the subsequent 2 years. The keys to success from our perspective are great mentorship. We are very fortunate here to have our Chief of Cardiology, Dr. Edward Philbin, our Chief of Cardiology at the VA, Dr. Joseph Sacco, and our Director of the Non-Invasive Laboratory, Dr. Stephen Fine, who are senior mentors for all of us, both faculty and fellows. Furthermore, Drs. Torosov, Sidhu, Mukherjee, El-Hajar, Nappi, Edelstein, Lubarova, Shulman Marcus, and Yeager are all active faculty currently participating in research, both with our fellows as well as our health staff and medical students. We will also work with you on accessing data, including large national databases, and learning on how to collect and analyze data properly, working closely with the IRB. We will support you in terms of statistical expertise, both here within our division as well as within the medical center and the college. And we will also expose you to clinical trials experience for all levels of interest, whether you are pursuing an academic path or whether you are pursuing practice in your future. I'd like to now take a moment to show you some of the work that our fellows have accomplished here over the 3-year period that they've been with us. Dr. Riju Banerjee, currently one of our 3rd-year fellows, the class of 2021, had worked on this important project with our faculty, Dr. Radmila Lubarova. Is our initial evaluation of patients admitted for syncope guideline-directed and cost-effective? This was published in the European Heart Journal, and very important to note that this also included other disciplines from the medical center. 2 of our fellows, our recent graduate, Dr. Hiren Patel, who graduated the General Cardiology Fellowship in the class of 2019 and most recently graduated the Interventional Cardiology Fellowship in 2020, working with one of our then house staff, Dr. Hamza Uglat, who is now a first-year fellow, looking at the prevalence and prognostic implications of pre-procedural hyperbilirubinemia in patients undergoing transcatheter aortic valve replacement. This was published in Heart and Vessels earlier this year in 2020. And one of our senior fellows, Dr. Evan Joy, who recently worked with our faculty, Dr. Torosov, on pulse cancellation echocardiography in Fabry disease as one of the first reports of this in the journals and literature. This was published in Echocardiography. One of our recent graduates, Dr. Lane Zhang, who has gone on to electrophysiology fellowship at the University of Pittsburgh, had published this review on the oral anticoagulation for atrial fibrillation thromboembolism prophylaxis in the chronic kidney disease population, the state of the art in 2019. And this was published in Cardiovascular Drugs and Therapy. Here we had a collaboration between our fellow Dr. Kelsey Peterson, who's now a 2nd-year fellow, and Dr. Riju Banerjee, now a 3rd-year fellow, looking at the coronary revascularization in high-risk stable patients with significant comorbidities, challenges in decision-making. And this was published in the current treatment options in cardiovascular medicine. And finally, one of our recent graduates, Dr. Heather Stahura, had published on the attainment of guideline-directed medical therapy in stable ischemic heart disease patients with and without chronic kidney disease. Dr. Stahura started this work as a first-year fellow. This was her scholarly project throughout her fellowship, and she saw this through to completion and ultimately to publication in 2019. And finally, one of our recent fellows, Dr. Basil Sauer, worked tirelessly with us on this piece in Nature Reviews Cardiology as a tactful reappraisal of chelation therapy in cardiovascular disease. I'd be happy to answer any of your questions and would urge you to please reach out to Dr. Mukherjee and to any of us as faculty if you have questions about the research and scholarly activity experience here at Albany Medical Center. Thank you very much.